When I was a kid, I never saw electricity. I didn't know what electricity is. I didn't know what it is to have a toilet or having a drinking sort of water next to your house. I just simply didn't know.
Angjuk was born in Humla, a beautiful but remote part of Nepal near the border of Tibet. It has always been a hard life for the villagers, with limited health services, under-resourced schools, and the extreme cold, meaning families run short for food each winter. But the Humli people are committed to changing their lives, to give their children a brighter future. Adara and the Humli community sat down together to find ways to improve their health and education.
And when I was a kid, I still remember, like, when you get sick, or your parents or you, when you get sick with simple headache or diarrhea, you just bear with it, because there's no medicines available, no one to give you medicines. And if things get worse, you might have to walk at least 3-4 days to get to one of those nearest health posts to get treatment or medicines. Oftentimes, those health posts, they're run by government. They don't have someone to give you medicine, or there's simply no medicines in that region.
And so, the mobile medical camps were born. Now, with the support of Adara, thousands of Humlis are treated every year by expert Nepali doctors. When the camps are not running, a Tibetan medicine practitioner travels from village to village providing free Tibetan medicine. We also work hand in hand with the government of Nepal. Together, we make sure the local health posts are improving so Humlis can access year-round care. We wanted to stop the deaths of 2,000 Nepali children who die each year from diarrhea caused by unsafe water and poor sanitation. With the construction of pit latrines and education programs that challenge generations of behavior, Humli people's approach to health is changing. Traditional cooking methods have been hurting Humli's breathing and respiratory health. So the introduction of smokeless stoves has been welcomed by young and old. And the nutrition and food are also improving. Now every household has access to a greenhouse, providing them with fresh green vegetables all year round.
It takes really time, but when you stick around and be persistent and work with them and try to educate them, things can change.
As well as health education, the Humli community have embraced the expanded opportunities provided by improved classrooms, teacher training, basic educational supplies like books and pens, as well as scholarships to ensure every child has the opportunity to learn and grow.
Whatever they learn at school, they come back and share with their parents, share with the other siblings. I think that's really sort of they are not only learning, they are also teaching their parents or their other family members.
Attitudes are changing towards education. More and more Humlis are now sending their children to school. And girls who traditionally were excluded from education are thriving in this environment. The first school Adara ever worked with, the Yalbang school, now has over 300 students. It is so greatly admired, it is now a model school for remote education in Nepal. And with quality education at their doorstep, children no longer need to be sent away to learn. This also reduces their exposure to child traffickers. Adara is so proud of the changes we have witnessed in Humla. We will keep working hand in hand with the Humli community to make sure all children have opportunities for a bright future.
I see the changes happening in that region, and that's really touching lives of people in need, including my own family, my own parents, my own siblings. We're so happy to be part of this wonderful organization and the people who work for this organization, and we have done so much and we still have so much yet to do.